Congress, as you know, they've gone back to the drawing board this week to come up with a health care reform plan that Americans can live with. And while that's going on, here's a question. What's in it for the doctors and the nurses and the other medical professionals, the men and women who are out there saving our lives? Let's ask two congressmen. They're also doctors. Republican Charles Boustany of Louisiana, a heart surgeon, and here in the studio, Republican Michael Burgess of Texas, who's an OB/GYN physician. Great to have you here, Congressman.
Thank you, Governor.
And Congressman Boustany, great to have you from New Orleans.
Thank you.
Let me get this underway by asking a question I think that has confused a lot of Americans. And Congressman Boustany, I'll ask you in New Orleans. We know that the president has said the AMA is supportive, and so therefore he sort of said the doctors are all behind this health care reform bill. Yet only 20% of the physicians in America belong to the AMA. Is there somewhat of a maybe not quite so honest approach? Are the doctors of America truly behind the health care reform bill that the Democrats have put forth?
I don't think that's really true. I think if you look at state medical societies, a number of the specialty societies, and I can tell you many, many physicians I've spoken to, both in my home state of Louisiana and around the country, they're opposed to this because they see the very heavy hand of government getting involved in every aspect of our health care in a very disruptive way.
Let me go to you, Congressman Burgess, because we talked about incentives, the fact that there ought to be something in there for doctors if they do well. Right now, doctors are reimbursed for the number of procedures they perform, not for the outcomes that those procedures produce. So if a doctor takes 7 tries to get it right, he gets compensated 7 times. The doctor who gets it right on the first time only gets paid once. It's almost like you're rewarded for not doing well. Should there be a way to reimburse physicians for the quality of the care as well as just the quantity of the care?
Well, certainly that's something that's been first and foremost. And in the previous administration, Secretary Leavitt, Governor Leavitt, had started what was called the Physician Group Practice Demonstration Project. When the results of that have just recently, the first round has been produced, where you actually reward a doctor or a medical group for doing things right. It's intriguing. There are some real savings that have been shown in that. There's some other areas where the actual savings that they thought would materialize didn't. But here's the deal. We're not doing the one thing that would incentivize doctors in a big way right now, which would be medical liability reform. We've done that in Texas. Oklahoma over the weekend just made a move to do that. These programs work when they're instituted, and yeah, people will tell me that it doesn't bring down medical costs immediately. No, there is some learned behavior involved that will take some time to adjust. But we have seen such a significant change in Texas since 2003. I frankly don't know why that is not part of the discussion.
Congressman Boustany, real quickly before we take a break here, I need to ask you, the congressman here has brought up about medical liability. It is a big issue. Doctors talk about it, but it's not something that the Democrats have been all that anxious to do. Would that make a big impact, not so much for you as a congressman, but for you as a physician, specifically a heart surgeon?
Well, there's no question that tort reform is necessary to try to bring down the cost of health care. It's not the silver bullet, but it's something that's desperately needed, in my opinion. Clearly, if you look at physician behavior and the things that drive up costs, the threat of frivolous lawsuits, and also the fact of the matter is that we do have a number of frivolous lawsuits that materialize and then go away over a matter of years. This puts physicians in a very defensive posture, and they tend to do more oftentimes than what might be needed just to protect themselves. It's one of the cost drivers in healthcare, and I think medical liability reform is clearly an important part of the reform effort.
We're going to keep both these congressmen here and visit with them a little more about the health care bill, how it's going to impact your life. We'll be right back. Do not go anywhere. We are back with Congressman Michael Burgess of Texas and Charles Boustany of Louisiana. Barack Obama has performed some magic here recently. He has been talking now for months that we had 47 million uninsured Americans. Watch this.
In the wealthiest nation on earth, 46 million of our fellow citizens have no coverage. Now, if you are one of nearly 46 million people who don't have health insurance, you'll finally have quality, affordable options. Now, I don't have to explain to you why it's so important to pass health reform for the 46 million people who don't have health insurance.
Well, okay, 46. I was pretty close. But then all of a sudden, and I want to get a reaction from both of the congressmen, this last week when he was speaking to the joint session, listen to what he says.
We are the only democracy, the only advanced democracy on earth, the only wealthy nation that allows such hardship for millions of its people. There are now more than 30 million American citizens who cannot get coverage.
Okay, I want to know what happened in the middle of the night that suddenly insured 17 or 16 million Americans. Congressman Boustany, let me start with you. What did I miss during a night?
Well, I remember really taking note of that change in the number, and you know, I suppose what the president did was he subtracted the illegal aliens in the country, but he didn't really explain the difference between the 30 million and the 46 million in his speech. So I can only assume he subtracted the illegal immigrants in the country, and but you know, that also highlights the difficulty with this number. And we on the Republican side of the aisle have said, let's break it down. Let's get really accurate numbers and see what's behind this. We know, for instance, that 4.5 million are college students and graduate students who, when they hit age 22, they're forced off of their parents' insurance. I think that's a bipartisan area of agreement that we ought to expand that age limit and let them stay on if they're still dependent on their parents. But the bottom line is you have to understand, what are we trying to do? And once you break down that number, target solutions to the problem.
Yeah, Congressman Burgess, I'll bring you in on this discussion. We've talked about the numbers, but I want to ask you this question. What in this health care bill do you like? Is there something about reform that we need to be doing that Republicans and Democrats could agree on and we ought to be focused on?
Well, Governor, in fact, there is, and it's disappointing to me that we don't focus on that. The one thing I heard from my town halls over the summer, people don't trust us to do something as big as we've carved out for ourselves. So what if we broke it down, as Dr. Boustany said, what if we broke it down to some of these populations that are really suffering, and people recognize that reform needs to happen, and we could do that right off the bat with the people who have what are called pre-existing conditions and so-called insurance rescissions. Nothing is more offensive to an American when they think about someone writing out that check and paying their premium every month. They get a tough medical diagnosis and their insurance is gone and they're uncovered. That's wrong. We could fix that. The president and I and most Republicans agree on that point. So we could sit down and have an actual deliverable for the American people. Fact is, we could have done that before we went home for August if we'd been serious about this. And again, the American people do feel betrayed by so many things that have happened this past 6 or 8 months. We took over their financial section. We took over their cars. And now we want their doctor's office. And people are fed up. And that's what they told us over August. And many of us got to hear that in many different creative ways.
Everybody that who went out there for the town hall meeting, some people were afraid to go to the town hall. Let me say thanks, Congressman Boustany, Congressman Burgess. Great to have both of you here. And hope we can visit with you again. And hope you guys will stay the course and keep the fight.
Thank you, Governor.
You already